Hi, I'm Dr. Brian Yeung, a naturopathic doctor here in Toronto. We'll be presenting a series of videos related to weight loss here on this channel, so subscribe if you're interested in learning more. Full disclosure here, I'm not being sponsored by any drug companies, nor do I have any personal experience using Orlistat. However, I manage weight loss patients who have used and are currently using these medications. From their experiences, I'm here today to shed some light into what you might expect if you try Orlistat yourself. Orlistat, also known as Xenical or Alli, works by preventing your body from properly absorbing fats that you eat. It does this by interfering with an enzyme in our body called lipase. Lipase normally breaks down dietary fats and allows us to digest and absorb them properly. By stopping it from working, our bodies are unable to break down those fats. As a result, those fats will pass undigested through our intestines and out into our poop. The idea is that by pooping out the fats, you won't be absorbing as many calories, and that should technically help you to lose weight. Side effects. Many people will experience smelly, oily, and sticky stools. You may find your stools difficult to control with sudden urgency to get to the toilet. Basically, you're gonna poop yourself a lot. A lot of people get gastrointestinal discomfort, things like gas, bloating, nausea, and stomach pain. Orlistat is meant to be taken while on a low-fat diet, and many of the side effects are magnified if you don't follow it properly. I find that those who stick closely to the low-fat diet still have some symptoms, but they're much more mild. Nutritional deficiencies may be a problem if you plan to take Orlistat for more than a month, as the drug may block the absorption of certain vitamins, like vitamin D. There have been rare reports of liver and kidney damage from Orlistat, so you may need to have them checked from time to time. Is it effective? I find that it really depends on what else you're doing. If you're strictly following the recommended low-fat diet, you should be able to lose 3 to 5% of your current weight over the next several weeks. A 180-pound male should expect to drop to around 170 pounds in a month or two. However, I find it difficult to determine whether it was the Orlistat or if it was the low-fat diet that was working. Additionally, those who take Orlistat and stop doing the recommended low-fat diet, and I'll know because those people come back to me complaining about some really nasty stools, they tend to quickly regain any weight that was lost in the first place. Personally, I feel like Orlistat is most effective at promoting low-fat dietary compliance more than anything. Basically, it forces you to go on the low-fat diet and punishes you and your toilet if you go off the diet. Should you do it? I would recommend it for those willing to do these two things. 1. I suggest it specifically for people who have found low-fat diets to be very effective and easy to follow for them in the past and want to continue going low-fat. It helps people on this style of diet stay committed and quickly and effectively lets them know when they've had too much fat in their diet. And 2, to make the most effective use of Orlistat, I'll often recommend using vitamin injection therapies or supplements while on the drug. This is to prevent any long-term nutritional deficiencies and ensure proper fat burning and metabolism while on the diet. I'll leave some information about low-fat diets and vitamin injection therapy down in the description for those interested. Let me know in the comments down below if you have any other questions about Orlistat, or if you have experiences yourself you'd like to share. If you found this video helpful, please leave me a like. As before, I'm Dr. Brian Yeung, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.